Hi, I'm Sam, and let me tell you how my grandfather inspired me to start Third Eye. About a year ago, he was admitted to intensive care for a heart attack where he was monitored 24/7. But he developed further complications and, with no clear cause pinpointed, it unfortunately led on to multi organ failure and eventually his death. And he is just one of the 85 million patients that will be admitted to intensive care for organ failure globally. But the moment they'll enter, the odds will be stacked against them, with their fate almost the same as a flip of a coin. Why does this exist, despite being in the most monitored ward? After consulting over 40 intensive care doctors globally, we found they have to consider a plethora of data when they're making their decisions for each individual patient. This isn't just overwhelming in size, but it's also divergent in its type. Therefore, key facts are missed, resulting in intensive care having the highest error rate in any hospital unit. Time is absolutely critical for an intervention to take effect, but the time to intervene is different for each patient, so doctors can't plan for it. Imagine being a doctor in this situation, having to decide on someone else's fate. This struggle is considered normal. But it doesn't have to be, because we created an evolving AI system that amalgamates and processes all this patient data and outputs the probability of deterioration, giving clinicians and patients the most valuable commodity: time. And our system is designed to sit on any hospital computer, giving clinicians insights about their patients. Let's see how this works on an actual patient dataset. The algorithm automatically triages patients in order of risk, whilst also classifying the reason behind it. In the case of patient 1, we flag an early warning for septic shock, but as the patient continues to deteriorate, we flag another warning and escalate the cart to the front. Though notice, the first warning was given 32 hours before onset and well in advance of current methods utilized in practice. We are fundamentally changing the game from detection to prediction and therefore prevention. And by predicting organ failure in advance, we enable targeted treatment and thus reduction in the probability of death. Currently, we can make predictions for these treatable organ systems, all of which benefit from early detection and intervention. And we've also tuned our product to benefit all of our stakeholders, so doctors can make more confident decisions due to the early warning system, whilst lowering the likelihood of patient death. And hospitals can increase their efficient resource utilization due to the automatic triaging and treatment justification. And our model can be adapted for COVID due to its versatility and evolving nature. And in preparation for this, we've ensured all of our code is written to be compatible with native digital record servers, and we've been documenting the entire design process for faster certification, for which we got invited to the Global Grad Show Entrepreneurship Program to showcase our products. We've also understood the competitive space, where we found the majority didn't really capture the full scope of clinicians' requirements, or they were still in their research phase. Our core business model will be tier-based software as a service, provided to both independent hospitals and electronic health record vendors. Our product development, testing, and certification will be in the UK. Our market entry, however, will be the US, which provides a perfect catalyst for growth given the high digital maturity. And we see a much larger market in the US, valued at $2.4 billion, with an annual growth rate of 30%. We began by talking to doctors and attaining the largest hospital dataset from MIT to train and validate our model. With this, we've won additional competitions, whilst also understanding the failure case scenarios from our industry partners. We've also partnered up with Imperial NHS Trust and AIMS India to be our expert witnesses in preparation for clinical trials. And we're also in talks with major data vendors to try and get access to their data. We're currently in the process of submitting our scientific results for review and have attained license for a much larger dataset. But with your £10,000, we can accrue bright minds and further develop the system to prototype completion. I am the founder of Third Eye, with expertise in AI, computer vision, and evolutionary algorithms, joined by Marta, who's a doctor by training and brings in her clinical expertise to assist with product development. And our new addition, Luca, who is a scientist by training and assists with business development and planning. Our advisors from AI side is Professor Anno Bharat, and from the clinical side is Dr. Hutana Sharafian. Both are bringing their expertise from academia and commercial by having run their own startups. I want to finish with the fact that we were told this quote during my grandfather's time, and I certainly didn't want to hear it then, especially now when we can do more. Thank you for listening.